Well, good afternoon, everyone. Thank you for being so prompt about lunch. I'm glad we managed to finish up the panel discussion before lunch so we could start fresh afterwards. Our first speaker up for the afternoon is Javier Guzman, who's currently the technical director for Pharmaceuticals and Health Technologies with Management Sciences for Health. And he is going to be talking with us about driving investment in regulatory agencies using Colombia as a case study. So welcome, Dr. Guzman, and the floor is yours.
Thank you. First of all, thank you very much for the invitation. It is a pleasure for me to be here. I'm here not because I'm part of MSH, but because I was part of the Colombian Regulatory Agency. And we thought it would be interesting to learn a bit more about what the Colombian Regulatory Agency has gone through to get where the agency is at now. Having said that, as part of the project I'm working on now, we're supporting about 18 countries in Africa and Asia to strengthen the pharmaceutical systems, including the regulatory agencies. So this conversation is very relevant for them when they think about how to drive investments, how to make the case, what's the entry point to be able to sell something that is very old, but is still very unknown and still very difficult to frame as essential because people are interested in, outcomes rather than systems and rather than institutions. So my conversation will be on Colombia, and I think it's a nice case study. So this is INVIMA. INVIMA was established in the health sector reform in 1993, but it started operations in 1995. So we could say it's a young adult. It's got like 24 years old. Now it has 1,500 people. But you'll see how the organization started with a bit more than 100. So there was a division within the Ministry of Health, and that division became the agency. And that is one of the frequent ways of setting up an agency. Our current budget is, I still say we and our, so you will apologize. I will apologize for that. Their current budget is $50 million per year, and they have offices in 11 of the 32 states within Colombia. And one big thing that is very relevant for this discussion is they also have presence in the most important ports of entry, and we're talking about ports, airports, and that is a very interesting part because of trade and because of the free trade agreements. Now, an essential part of a regulatory agency is the ability to monitor and to assure quality, and labs are key for that. And the agency has 7 certified labs. So that's in a nutshell where the agency stands today. But that wasn't like that when the agency started. So what I said in 1993, the health sector reform passed. Nobody actually cared much about the agency. People cared about the reform because the reform was moving from a national health system to a social health insurance system. So that was a very big change. So people didn't actually realize or understand the importance of having an agency. It was just one article in a very long and important law. And when it started on the 1st of February 1995, it had 123 employees. So it was very small, and the focus was mainly medicines. I say mainly, but I could say the focus was only medicines. Then things started to change. Of course, more people came. In 2007, there was a big law that was also relevant, another article, where the INVIMA got all the regulation related to food safety. So it was at the time when the two components were merged together. So it wasn't planned like that. It was something that was added later on. It was added, like 12 years after it started. And that also gave the agency additional staff, like about 286 more people. But still, it was a weak agency. So people thought of the agency as, the place you go to, hand over documents and to get stamps. Kind of like a post office, You go there, you take your documents, and then you go, and that's what it is. So people didn't actually acknowledge any technical component or technical review or technical assessment of anything at the time. So I think things changed for the better from 2009 onwards. So I think, and this is basically the presidential period in Colombia is 4 years. So the previous president started in 2010. So he was, his name Juan Manuel Santos, he was our president between 2010 and 2018. So basically what I'm describing here is it coincides with his mandate. So it started, and I think this is very important, with two big events. The first one is the importance of having a quality assurance system. So before that, people were just doing things, differently, of course, and quality and maintaining quality was not that relevant. But at that time, it was the first time that the agency put the quality management system in place. Also for the labs, so that's also key. How these certifications do improve the agency within, but also it's a very nice way to signal the market and to let everyone know that we're serious, that this is not just a post office. The other point is how an initiative was going on in the Americas, led by PAHO, had an influence on the agency. So 10 years ago, PAHO wanted to assess the regulatory capacity of the different national regulatory agencies in the region. Nobody had done that, or if they had tried, they were not successful. So INVIMA was part of the experiment. And looking backwards, it was a very good decision because that motivation created pressure. Because when they came, they did the assessment. The assessment, to be fair, didn't go that well, but because the system was that new and because PAHO didn't want people to say, if Colombia is not there, other countries might not be willing to have the assessment, they decided to say that we were level 4 or we were a reference agency. I think in looking at the past, we might not have been ready yet, but it was only for medicines, not for biological products. It didn't include our labs. So it was like a partial process, but it was extremely important, again, to create support within the agency, within the government, within the country, and then to have the stakeholders understand the importance of having a reference agency. That was 2009. Then a big thing happened in 2012, and I think this is the key big point, which is why we had an organizational redesign, why we had it. And I'm going to go into that in a minute. And from that, basically, it's been improvement after improvement with a lot of focus on risk, a lot of focus on bigger and better infrastructure, a lot of focus on moving from paper-based to having electronic everything and strengthening our labs. But I'm not going to go into a lot of these details because I want to basically talk about this organizational redesign because I think it's the major milestone. And the question of why it happened and how it happened, I think is relevant for this group. So this is basically in figures the change. So in 2010 we were here. This is budget, total budget in in million pesos, and this is the current budget. This is the latest year here in 2016. So it's more than it has more than doubled. So between 2010 and 2012, the budget nearly doubled, and that was related to the major restructuring. If you look at If you look at people, so before that major restructuring, the agency had 481 employees and a lot of contractors, maybe 800 contractors. They would come every year, maybe February, March, because January was the time to do the contracts. They would finish October, November, because they had to submit all the reports before the end of the year. And then a lot of politicians would say, I've got a couple of CVs for the next round, so please include these guys in the next round of contracts. So we would get a lot of people coming and going with a lot of political ties, with a lot of relations with politicians. But then the reform was basically creating the civil service, so creating 1,520 positions that cannot change regardless of who is in power. The president, the director, the board, they cannot change who these guys are. So the flexible management team is about 50. So out of 1,550 can be changed with new administrations. So I think this is a very important step. The other point is that most of the people are very qualified in nature. So that is also interesting. So within the government, within health, I think the agency has one of the top levels in terms of qualifications. So why did it all happen? Was it because we health people were very successful at saying, safe, effective, quality medicines are important for the Colombians? Well, it wasn't because of that, unfortunately. Or fortunately, it was only because of trade. It was only because of free trade agreements. So Colombia basically signed a lot of free trade agreements in the 90s and early thousands, but the free trade agreements were basically to let other countries export to Colombia without tariffs and without barriers, because we basically didn't use them much. Yes, we had coffee, yes, we had flowers, but coffee and flowers were already in these markets and with preferential treatment, and our biggest export is oil. But then what happened was the oil price dropped and we were in trouble. And when the oil price dropped, basically the government said, what are we going to do? And then we had a lot of pressure to demonstrate that the free trade agreements were successful. So the question was, what are the key exports Colombians could actually put in markets where we have free trade agreements? And one of the key exports were animal products and food. I'm talking about, meat. I'm talking about milk and derivatives. I'm talking about food, processed food, I would say. And because of that, we didn't have any tariffs or tax barriers. What we had were sanitary barriers. And because of the sanitary barriers, they got the regulatory agency to play a very important role in that work to use the free trade agreements. So the National Development Plan in 2010 included an article on the importance of food safety and traceability. And if you look at the article, it is a very nicely written article because it talks first about Colombians. So it says, yes, we want to secure the food safety for Colombians and the food supply. And then the last part it says, and also export our products. But that last part was the important part. And we were basically kind of like taken from, a national domestic sort of conversation to at a different level. And that level was led by the Ministry of Trade and Industry and the Office of the President themselves. So we got two champions there to talk about why INVIMA was important, why regulatory barriers were important, to be able to use free trade agreements, to be able to increase our manufacturing base, to be able to have more exports. And that's how it all started. So it wasn't because of medicines, it wasn't because of concerns for, food outbreaks. It wasn't because of pressure by, the growing middle class. The growing middle class still do not know much about, food safety, to be fair. It was mainly because the country and the government needed to export something, and we just didn't know what to do to be able to fulfill that goal. A very important point is the agency, didn't receive any cent from the central government, even in these interesting times. The government didn't give any money, but what the government did was to allow the agency to use the revenue that had not used for the past 5 to 8 years, savings, to be able to invest into the infrastructure, into the new personnel, into the labs, into everything else. So the agency has been self-funded since day one. And at the beginning, people didn't actually notice this much because the fees were very small. So the fees were not bother a lot of people. Then in 2011, fees increased by maybe 60 to 70%. So they increased to a level that the industry, the pharmaceutical industry, the manufacturers, the national pharmaceutical industry decided to sue INVIMA and to take the case to court because they said it was illegal to have those outrageous fees. But the court decided to say, they have the mandate to set the fees, and if they have an appropriate methodology and it's transparent, the fees could be as high as they want, sort of like that. So that was a very interesting point because it was a very big backing for a self-reliant system. And I think that is key. Otherwise, you depend a lot on cash flows and the situation, and it's not sustainable year after year to ask about how much money I'm going to get in a country that, have a different or a lot of competing priorities. So talking about the pharmaceuticals piece, so this is something that is added on the previous story. So this part is basically how things were also happening in the pharmaceutical space. So in 2012, the government decided to issue a pharmaceutical policy. And they took the opportunity to include the regulatory agency as a central structure within that pharmaceutical policy. And they had the original assessment by PAHO saying, these guys seem to be doing a good job. And in fairness, PAHO said, we'll be back in 3 years. So it was kind of at the time when the government decided to say, we cannot be first a reference agency and then in the reassessment to be something else. So that we had that pressure to keep the status, to maintain the level. And the government included that in the pharmaceutical policy. The other interesting component is the Pacific Alliance. So the Pacific Alliance was basically established at the beginning of the Santos presidency with Mexico, with Chile, and with Peru. Neoliberal economies, neoliberal countries, similar approaches to trade. And the mandate was harmonize, reduce the barriers, try to get, a single market. And that's what we did. So Mikel was part of those discussions when he was the COFEPRIS commissioner. And it was hard, but it was also pressure from outside that was used to steer the positions inside. And what I'm saying by it is, if the Colombian industry and the manufacturers and the consumers were only thinking about Colombia and the safety and and the market without thinking about the global economy or without thinking about these regional initiatives, they just want to have the lowest possible regulatory standard. Because, civil society is still not strong enough. Middle classes are not very, empowered to demand appropriate levels. And the private sector and the manufacturers, whenever someone says we're going to raise the bar, they're going to say you're going to kill the industry. You're killing your own industry. Jobs, taxes. So governments are very scared about making those decisions. But if you're saying, this is good for you, manufacturers, because you will be able to export to other markets. Also, look at the case of Mexico, look at the case of Chile, look at those standards and tell me why we're not able to get to that point. And also, we want to go towards, we're going to go there at some point. So we better do it now and we prepare for it. So I think that conversation is a difficult conversation when you have a strong manufacturing base. If you're talking about countries where they're not protecting the local manufacturing, is much simpler. You just set the standards and the importers will have to comply. But anyway, I'm just saying it was important for us to have the Pacific Alliance. It was important for us to have PAHO. It was important for us to have the entry point as the free trade agreement and to include the pharmaceutical policy as part of the conversation. Now, we had the fortune of having a Minister of Health who was not a politician. He was an academic. He was a PhD from Berkeley. And he was an economist. And basically he stayed in his position for nearly 6 years of the 8. So that was stability and respect. And of course we had a lot of problems, but he was a very important champion. And also I have to say, PAHO, yes, they were important, they were relevant in terms of getting us to discuss the levels, the regulatory levels, but they also provided support along the way. They were good brokers in terms of this is about the region, and good brokers to set up platforms for us to be able to talk with our peers, other regulatory agencies, for us to do south to south, for us to be engaged into capacity building activities and the decisions on the procurement, for instance. So the centralized procurement that is done by PAHO is well aligned with the system of assessing regulatory capacity. So if you are an agency that is level 4, any product that is registered with that agency is like if we had a pre-qualification standard. So that is a clear incentive and that is a clear signal to the market that this matters. And just to finalize, trying to summarize everything I said, we just had a nice window of opportunity. The entry point was, it might sound naive, but to me, it was unusual. It was not what health people were thinking of or what health people were advocating for. We all I'm a health person, so we all think, the health of the population, and that's why we're going to, get better systems in place and better processes in place, and we're going to, get support to talk about health. But it was down to trade, and it was fine because we just took the opportunity and then we got value added. And some key factors, I think, the financing model, otherwise it wouldn't have been possible. So setting up good legislative framework for the agency to, recover the user fees. Champions along the way. That's not rocket science, but I think it's important. It's also, I think, key, the push and the support from some international organizations. So PAHO is key whenever we talk about health. I also included here OECD. OCDE is the Spanish acronym, so sorry. And then the Global Alliance for Trade Facilitation. Why OCDE or OECD? Santos wanted to do two things in his government. He wanted to sign the peace deal, which he did, and he wanted Colombia to be part of the OECD. That's it. So with that in mind, when we were discussing with the OECD members, they were reluctant to let us in because of a lot of discussions about how we, regulate. So good regulatory practices were extremely important in terms of accessing OECD and demonstrating change and demonstrating that good regulatory practices had been included within the regulatory agency was a nice selling point to say this is also relevant for that purpose. Kind of like aligning whatever we were doing with the highest goal that was coming from the Office of the Presidency. And then the Global Alliance for Trade Facilitation, they had signed a very nice global agreement, and they set up this private sector, public sector, and they needed demonstration projects. They just needed to show that they were getting results. So they were around looking for low-hanging fruits. And we said, we have few. So they gave us money. And if you look at their annual report published last week, the first case is in Vima. Win-win. They got us money. They got us support. We gave them the low-hanging fruit, the tangible result they were after. And what was it? It was basically expanding our risk management system to facilitate imports and exports. So we changed the way we basically do our inspections at the point of entry. That was everything I wanted to say. Thank you very much.